All right, thank you all for joining today for the Reactiv8 patient education webinar. I'm excited to kick this off with two physicians tonight, Dr. Robert Heroes and Dr. Meredith Langhorst. I'm having a little difficulty. There we go. We have Dr. Robert Heroes, a pain medicine physician joining from Oregon, and Dr. Meredith Langhorst, a interventional spine physician joining from Indiana. So I will now kick it over to them to start the event.
All right, thank you guys. As Kendra said, I'm Rob Heroes, and I'm very happy to be here with my friend and colleague, Dr. Meredith Langhorst, and we're very excited to tell you guys about a new therapy for chronic back pain. And I'm going to see if I can control this. There we go. So chronic back pain for somebody like Dr. Langhorst and I, this is a very, very common thing that we see in our office literally every single day. And yet, despite the fact that it's so common, it's one of the most difficult things that we see. So chronic back pain is so common that it's maybe the number one or two reason people even go to the doctor in the first place. It's one of the most common reasons people have to stay home from work or from school. And that has a huge impact not only on their life from a social standpoint, but professionally, economically, and has a huge impact on society as a whole economically as well. And one of the challenging things about chronic lower back pain is it can be very difficult to know what's actually causing the pain, and therefore it can be very difficult to actually treat it effectively. And unfortunately, a lot of patients with chronic back pain end up getting surgery that they maybe didn't need or aren't likely to respond to. Kendra, I think I'll just have you do the slides. If we can advance, there we go. So part of the thing with back pain is kind of figuring out what kind of back pain it is. And we really break it down into two major different types. And you see here on the left, that person has a lot of leg pain, and that's traditionally called sciatica, which really just means nerve pain that starts in the back but radiates all the way down the leg. Another way to think about that is nerve pain. So a lot of times that's electrical or burning with numbness and tingling shooting all the way down like a lightning bolt. That's often a ruptured disc or a bulging disc that's compressing or pinching a nerve. And while we do have a lot of different kinds of treatment options for this, this can often lead to back surgery. And it's interesting because back surgery works pretty good for this kind of pain, but it can also cause this kind of pain. And when we do that and we end up treating it with injections and physical therapy and medications, a lot of times those help, but when they don't, we're kind of at the end of the road. And what we often do for these patients is something called spinal cord stimulation, which many of you perhaps already know about or maybe even have experience with. The thing about spinal cord stimulation that's good is that, you can try it temporarily and see if it helps. But on the other hand, it's not a great predictor, and it's strictly palliative. So it's just a very, very fancy, high-tech, and very expensive electrical Band-Aid. It's just trying to reduce pain. Now, for nerve pain, that's one thing. But for the other kind of back pain, which we call mechanical back pain or axial lower back pain, that's a completely different animal. So that's just back pain that stays in the lower back region itself, maybe into the buttocks, but not really into the legs at all. And that's often due to a problem with the multifidus muscle, which is a deep core muscle. And that muscle can be weak or damaged, and that leads to different types of instability problems, which we'll go over in a minute. And there aren't a lot of great options for that. Surgery is rarely indicated. Unfortunately, that doesn't mean that people don't get surgery. They do get surgery for this kind of back pain, and it typically does not work real well. But we have a new option for this, and that's Reactiv8, and that's what we're going to talk about tonight. The interesting and unique, exciting thing about Reactiv8 is it's not just an electrical Band-Aid. It's actually treating something. It's actually restoring and rehabilitating this muscle that we think is kind of the underlying problem here. So big, big differences. Now, the other thing about the mechanical back pain is that it's actually the most common form of back pain. So about 2/3 of patients with chronic lower back pain are going to have this mechanical type of pain where there's not an obvious pinched nerve or surgical indication. and it can be very, very challenging, as we've mentioned. Next slide. So what is the role of this multifidus muscle? And you can kind of see the different layers of the multifidus there on that spine image. So there's a lot of different parts of our, what we call the core, which is this muscular and skeletal system that provides stability to our spines, which is really important. When we get up, when we sit down, when we move, walk, run, anything like that, the spine has to have stability. And the multifidus is the deepest, strongest core stabilizing muscle. There's a lot of more external or superficial muscles, but the multifidus is the biggie. And it's also an involuntary muscle, which means that it contracts when your brain senses that you're about to move. So it contracts kind of in anticipation of spinal motion to help keep things stable. And you can certainly see why, if that wasn't working properly, how that could be a problem. So what we think happens in a lot of these chronic lower back pain cases is that something happens initially, whether that be a trauma, an accident, a surgery that went wrong. Something happens where you get this damage to the spine or the muscle itself. You get overload of the tissues, so excessive stress and pressure on it. Now that causes pain, but that pain also in turn kind of shuts the multifidus muscle down. And we see this with knee pain a lot, where if you injure your knee, the big thigh muscle, the quadricep, that muscle kind of atrophies and shrinks just from damaging the knee. And the same thing happens with the back. So you have an injury, there's pain, it inhibits that core stabilizing muscle. And then if the primary thing that stabilizes your spine isn't functioning properly, well, then there's going to be a little bit of instability. And then if things are unstable and moving excessively, that's going to add to excessive pressure and tissue overload. So it's kind of this big cycle. Next slide, please. And here we see that cycle again, starting with an injury, inhibition of the muscle, an alteration in how our brains and our core control spinal stability. And the other thing that leads to is that atrophy. I mentioned it with the quadricep, but here on the right, you see the multifidus muscle. The multifidus muscle, I'm not sure if, Kendra, do you have a little mouse, or I'm not sure if I can see that. If you can show us, yeah, if you can show us the multifidus muscle, perfect. So that's the multifidus muscle on either side. The multifidus, or any muscle on an MRI, and these are MRI images, a healthy muscle looks black. So that dark area is just solid muscle. The white stuff that you see kind of growing in these middle and the lower picture, the white stuff is fat. Fat should not be in a healthy muscle. So that's an indication that there's been a lot of muscle atrophy. And this is what we see over time when there has been this damage to this system, is we see atrophy of the multifidus muscle on the MRI. Next slide. So when we see this in our clinic, we have a lot of options. They're somewhat limited, but the most basic thing people do when they hurt their back, they stop doing things. They just rest. And sometimes that helps. So tincture of time, as they say, and rest, physical therapy, other kinds of hands-on, but very non-interventional conservative treatment like chiropractic care, acupuncture, massage. A lot of times patients seek this out before they even get to the doctor. And if caught early enough, a very knowledgeable, skilled physical therapist can be very helpful in preventing this feedback cycle, or this repetitive cycle of pain that we just talked about. We use medications, whether that's over-the-counter things just like Advil for inflammation, or Tylenol, to prescription medications like muscle relaxers, or certain types of antidepressants can help with pain. And of course, narcotics are used a lot, unfortunately. Kind of going up the ladder of intervention, steroid injections and other types of spinal intervention like radiofrequency ablations are often used with some degree of success for some patients. Next slide, please. So this is just to kind of show the different targets. And Kendra, if you could start on the left-hand picture, the top. So that's a facet joint, or a facet joint. It's where the two backbones click together. Common to have that be a source of pain. So So there's actually pain in that joint from excessive motion or a little bit of instability often. And we can inject steroids. That's where ablations can help sometimes. If we go down the next one, that's the sacroiliac joint. It's kind of pointing right at the SI joint, big joint in the back of the pelvis. Very common area to have back pain or even buttock pain. Further down is near the tailbone. We can do injections near the tailbone for that type of pain. And then on the right, the upper arrow is pointing at a nerve. We do lots of procedures to help with the nerve pain, as I mentioned when we started this. And then the last arrow there is showing a disc. That's another potential pain generator. And for years and years and years, for people like Dr. Langhorst and I, this is what we've had. We have had to look for a source of pain and then try to control that pain symptom. Next slide. Now, the really super exciting thing about Reactiv8 is that it's actually treating the underlying cause, not just treating the symptom of pain itself. So on the left, we have all of these palliative options, which is what we've had, and that's really the best we've had for a long time. And that's just treating the symptom of the pain. And that's whether it's medications or injections or spinal cord stimulators. But that's frustrating even for us as physicians because, as Meredith and I talk about, patients every day, doc, I don't care what you do, just fix it. And sadly, we've never had that option. We've never had something that can fix lower back pain. And I think that Dr. Langhorst and I and a lot of other physicians like us are realizing that we have that potential now with Reactiv8. So it's not just treating the pain, it's actually treating what we think is the underlying source of the pain. So it's not palliative, it's rehabilitative, and it's restorative. And it does that by restoring muscular function and control, which in turn leads to improved spinal stability and less of that excessive motion and wear and tear. So it's really reducing pain by addressing the actual cause. So very exciting. Next slide. Now, what this is Reactiv8 is an implanted type of nerve stimulator. There's a battery, which is the thing that's glowing there with the Reactiv8 name on it on the left. And then there are 2 electrodes or wires. Now, these wires are positioned at a very specific location to stimulate the nerves, which normally supply and contract and control the multifidus muscle. So it's a standardized location, same place every time. It is very, very minimally invasive. While this is a surgically implanted device, it is completely outside of the spinal canal. So we're not going anywhere near the big spinal nerves or the spinal fluid or the spinal cord. So it's actually a very low risk procedure. Those electrodes are connected to the battery, which is called an implantable pulse generator, but it's just a battery, really, a computer and a battery. And the battery itself typically kind of goes in the love handle area is how I would describe it. I don't know if you guys have one, but I sure do. And that's where it would go. Next paragraph or next slide, please. So once this is implanted, we give a patient a few weeks to just recover from the surgery to put it in. And then you come back to the office and the device is turned on, it's programmed, and you learn how to use the device. And the nice thing about Reactiv8 is it's a very specific prescribed therapy. So there's not a whole lot of variation in terms of wondering what to do. This is a twice daily therapy that you are in control of. So the patient has a controller and you turn it on twice a day for 30 minutes. Now, as the picture shows, this is done laying down either on the side or laying on your stomach. And for the most part, people seem to think that this works best doing it last thing before bed. So get in bed, turn this thing on, and it will turn itself off after 30 minutes. So you can fall asleep with it on. And most of my patients, and I think Dr. Langhorst would echo this, feel like it's pretty comfortable. They actually like how it feels. I have not had anybody say that they think it's uncomfortable or painful. A little bit odd at first sometimes, but for the most part, comfortable. So it goes for 30 minutes and then it turns itself off. And then a lot of patients the next morning, they'll set their alarm a half an hour early, turn it on, go back to sleep, and then they're done for the day. So very straightforward use. Next slide. So again, what Reactiv8 is doing is restoring control of the nerve signals to this deep core stabilizing muscle, the multifidus. It's restoring function of that muscle and allowing it to provide spinal stability. And this is why this is such an exciting therapy, because it's actually treating the underlying cause. So again, it's just hard to overemphasize for Dr. Langhorst and I and other doctors around the country who have embraced this, how different this really is and how exciting it is. Next slide. Now, we know that Reactiv8 works because it very, very frankly has some of the best evidence in spinal stimulation. So in all the different types of stimulators that we use for pain, it's called neuromodulation or neurostimulation. Reactiv8 has data and evidence that is truly unique and unparalleled. So we have long-term clinical outcomes out to 3 years, showing that about 80% of patients respond to this therapy and have improvement in pain of at least 50%. 70% of patients who were in this big research study who were taking narcotics were able to reduce or eliminate the use of opiates entirely. And if you see these little graphs, the exciting thing is it's not just an initial improvement that then stays stable. What we see with Reactiv8 is slow and steady year-over-year improvement. So at 6 months, patients are typically doing better than they were at the beginning, and at 12 months, better than they were at 6 months, and at 24 months, better than they were at 12 months, and so on out to the 3 years, which is what we have the most recent data on. So progressive, long-term, stable improvements in pain and function, and that kind of what we call durability is very, very rare in this field of medicine for interventional pain options. So this is really, really exciting. Next slide. So Reactiv8 is also safe. That's something that we also learned from this big clinical trial with over 200 patients out to 3 years. Very favorable safety profile when we compare it to other types of nerve stimulators or spinal stimulators. Now that says no lead migration. So what that means is that these electrodes that are involved in Reactiv8, we put them in a certain spot and they stay there. In other types of stimulators where the nerves are just kind of floating in the spinal fluid or floating outside the spinal fluid, they tend to move, they can migrate. And then if they're not where we put them, it's hard for it to do its job and help you. So these little electrodes actually kind of anchor in there and they stay put. So at 3 years, 0 of the initial 205 patients had a lead migration. So that's very, very exciting. In terms of adverse events, needing surgery or infection or a surgery to do a revision, very low rates, again, very comparable to other types of stimulation. So very favorable profile. Next slide. So again, to conclude, this product, this device, this restorative neurostimulator therapy, which we call Reactiv8, this facilitates actual recovery. This is not just treating pain. We have wonderful, high quality data that proves that this is a safe and effective therapy with good lasting results in, again, 75, 80% of patients. And the fact that you see the improvement continue to improve over time, that really makes a lot of sense, since we think about this as being kind of a rehabilitative therapy. In a sense, we kind of think about this like an internal physical therapist or something. So the fact that you see this progressive improvement over time makes sense. And again, 75, 80%, that's not 100%. So there's no guarantees in life, and everyone who's a good candidate is not going to respond. But to get 75, 80% of patients at 3 years responding is very, very promising. Next slide. So who is this for? So this is for patients who have, again, this mechanical back pain. I would say pain over a year. If the pain hasn't been around more than a year, there's more than likely still some room to try less invasive things. And this is not something that you rush into when you've had back pain for a few months, in other words. So if there's mechanical back pain and it's been around more than a year, it's okay if there's a little bit of leg pain, but what we'd want to see to feel that you are a good candidate for this therapy is leg pain that is above the knee. So if it goes into the leg, it doesn't go all the way down to your foot, and that the leg pain is very secondary to the back pain itself. We want this for patients where there's clear evidence for dysfunction of the multifidus muscle, because that's what this is treating. There's two ways we determine that. There are a couple of very specialized physical exam tests that we do in the office that give us evidence to think that this is happening. And then, as I mentioned and showed earlier, that presence of the fatty infiltration or the atrophy of the muscle on the MRI. So when both of those are there, we're really thinking this might be an option. Now, this is also not for patients who have had prior back surgery. You see that x-ray right there, there's a bunch of hardware. That kind of hardware is normally put in from the back, and it kind of goes right through the multifidus and destroys that muscle a lot of time. So for a big fusion like that, definitely not an option. Maybe in the future, we will have evidence that says for other types of surgery, which are less invasive, which didn't destroy the multifidus, that this works. That's being researched right now, but as of right now today, we don't have great evidence for that. So if you've had back surgery before, unfortunately, not a good candidate for this. The other thing is that we don't want patients who need surgery. If there is an obvious indication for surgery, like severe spinal canal narrowing or stenosis, and that says unstable slippage. So that's not talking about the little bit of instability that we think we're treating with Reactiv8. We're talking about when there's a big slippage of one bone off of another that's truly the whole spine is unstable. That needs to be addressed surgically. And the other thing is that SI joint pain. If the pain is truly and directly related to the sacroiliac joint, we prove that by doing injections. And if that really is the case, then Reactiv8 is not the ideal option either. Next slide. And then, so finally, just to kind of recap that, is it right for you? Well, from a patient standpoint, that last slide is kind of from a doctor standpoint. From a patient standpoint, what Dr. Langhorst and I hear from patients who end up being good candidates for this are a lot of common complaints of repeated occurrences of pain and spasming, and even kind of a feeling that the spine doesn't feel stable. And that grows over time to become disabling. It can be a lot of pain from something that you wouldn't expect to be really painful. So even just bending over the sink to brush your teeth or to put makeup on or shave, that can be severely painful. Doing dishes, things like that. Sitting, standing when you don't have a lot of spinal support. So sitting on a stool, for example, standing up for a long time. A lot of that time that can be painful, and it is a little bit better if you have that support. And then prolonged, sustained postures like sitting, driving, standing again, walking. That really can indicate that this might be something that would be helpful for you. Next slide, please. So that ends my portion. I really appreciate everybody listening, and I hope that was educational for you. It's my distinct pleasure to hand this over to my colleague and good friend, Dr. Meredith Langhorst, to introduce some really wonderful patient stories. Meredith.
Thank you, Rob. I appreciate it. That was an absolute fantastic presentation. And a lot of what Dr. Hero said is so true, in the sense of, we see these patients all the time. They come into our office every day. You'll meet some of them here in just a minute. But it's been very frustrating road for them to not have any type of durable, successful options that we've been able to offer them for managing their symptoms. And one thing you had mentioned, Dr. Harris, was that it's been equally frustrating for us as physicians to not have the ability to offer a therapy or a treatment that can change our patients' lives. And I was very fortunate in 2016 to become part of this large, greater than 200 patient trial that Dr. Heros has been mentioning throughout his portion, which is where one of our first patients that we're going to meet tonight, Eric's story started. He had been a patient of mine for, I think at that point, 6 years. And we had been working on managing symptoms, right, with those injections and therapies and whatnot. And it was in the beginning, maybe a few times a year that we would meet. And then over time, it was, multiple times a year. And then it was sometimes monthly. And the symptoms just, become so overwhelming, as I know many of you on this webinar probably are going through yourself. it really was that we were both in kind of the right place at the right time, that when I saw Eric on that day in the office in 2016, it was, Eric, you meet all of the criteria that we have of this new therapy that we're testing. Now, mind you, I was very hopeful, but we didn't have data. This was just the start. And, you know, Eric had suffered long enough, which you'll hear about his amazing story. And he didn't know either, but he was at a point where, right, he had to put his hope in something and was ready to take the next step. And so, Kendra, if you can share the next slide, that would be great. So here's Eric. He is a veteran. He was full-time employed, manual labor. And as you'll hear, just life got harder and more challenging every day because of his back pain. He was missing days off work. There was even the time when we were going to discuss, you know, is disability the right thing for him? And despite, you know, medications and injections over time, his pain just progressed. And you can see the pictures here that we have next to Eric are his imaging. And the very bottom picture where the red circle around is where you can see some of that multifidus atrophy or that fatty infiltration that started there. His MRI shows that, you know, he has a one bad disc in the middle at 4.5, which is also very common for individuals. And we couldn't fix that for him. In the graph here that we see now, I will say Eric is not always necessarily the traditional patient. We call Eric a fast responder, but you can see he came in with baseline pain scores around 7, and within 6 months was at less than a 1. And over time, his pain has been essentially non-existent. And the amazing story, though, is the functional change that Eric has had in his life that's, you know, affected his physique, his mental status, his home relationships, his job. And you'll see that here in Eric's story. It's an amazing story. I get tears in my eyes every time I listen to Eric tell it. And I'm just honored that we all in this therapy can be a part of Eric's journey. So Eric, do you mind? I'm going to turn it over to you to tell everyone this amazing journey you've been on.
Can you hear me all right?
There we go.
There we go. Sorry, I got the wife and the kids. They just all got home from church. So if there's a little background noise, that's everybody just getting home. So, so where did you want me to start? I'm sorry.
No, that's fine. I wanted you to start from maybe just a glimpse of your life before Reactiv8, as far as it related to work, maybe even a little bit of mental health status, where you were with just level of exercise or just function even outside of work at home life.
So in 2005, I actually joined the military. And everything about that point in time was going fairly decent. Never really had any back issues. In 2007, I was deployed, and that's kind of where my back problems started. Was shortly after I got home, a couple of years after I got home. I was working in a factory where I was pushing and pulling crankshafts for Detroit diesel, just huge crankshafts, and I remember that one day that I was pushing one of the crankshafts to another part of my station, and my back literally had went out on me, and it was just absolutely miserable. And then after that, it kind of just snowballed from there. And that's when I started coming to see you and trying just to manage the pain and trying to get a grasp on the situation at the time.
Right. And at that point in time too, work, I mean, was that becoming a more challenging issue for you?
It was really starting to affect everything. And actually I lost that job because I was on short-term disability because of that issue. It was even on Father's Day, I got my separation letter, in the mail. But it put me out of work for quite a while, just trying to get back on my feet, because I don't remember exactly. There were so many incidents where my back had went out, but I know that was a good one. And I know that I was out for a while, at least I think 6 months or 4 or 6 months, somewhere in there. And then that's when I ran out of short-term disability. But it really, I mean, as a dad and a husband, it was stressful, because my responsibility is supposed to be able to make ends meet for my family, and not being able to go to work. It was depressing and really very, very stressful.
Yeah. And what about outside of work? What were some activities that you wanted to do maybe with your family that you couldn't do, that you had aspirations of doing?
I had to be very careful about playing sports with the kids. Um, Being able to go hiking. I love being outside. I love hunting and fishing and doing those type of things. And it really started to limit what I could do, because I was always worried about twisting wrong, doing something, taking the wrong steps, slipping. Picking the kids up was another issue that was always in my mind. Like, if I leaned forward and grabbed a hold of them and stood straight up, I mean, it could have put my back into one of those little spasms, or whatever you want to call it, just put me down for a little while.
Mm-hmm. You know, there's a picture on the screen of you here that shows you as a runner. Now, were you ever a runner before
No,
your, yeah. Had you
no, I
ever
hated
thought
running.
about being a runner?
No, actually, my uncle was the only person in my family that actually ran. He ran the Boston. I always thought that was pretty cool. But as for myself, absolutely not. Even in the military, I only ran just enough to be able to pass my PT test. Um, and then outside of that, it was not enjoyable. But things change over time.
Right, right, they do. So you took the leap of faith, you had Reactiv8 planted, and what were you I mean, were you nervous? Were you worried? Were you worried it was going to hurt? And what were your thoughts as you were going through that kind of we call it perioperative process?
So my mind works a little bit different than some people, I guess. I was at a point of time where there was something had to change, and the pain was very, very excruciating. Um, and it was almost like that was my normal lifestyle with all the pain. And I remember that last time that I had my last incident where I was just leaning forward to grab that handle on that dumpster, and I was in the hospital for 5 days or whatever. It was, um, I think that was one of those breaking points. Was just, I was so frustrated that when this option came available, I wasn't really worried about it, other than when I first seen the device, I was like, it kind of shocked me that it looked like that. But I'd been through so much already that I really didn't care, as long as it was going to work. And so I was willing to try anything to relieve any of the pain, even if it was if it was only got to about half of it, I would have been more than happy with with the outcome. But
Great. So you were activated, you've been using your therapy, and what are some of the first things that you noticed or changes maybe in the way you were moving or sleeping, and that made you think that maybe this therapy was really going to work for you?
when the first big thing was, well, there was two of them, and they kind of coincided with each other. One, I've never been able to sleep all night long, just because tossing and turning. Excuse me. The pain would wake me up in the middle of the night, and I would feel like I would have to pop my back or stretch or do something, trying to be able to readjust, to be able to get comfortable again. And then, but within just a few days, that first week or so, when I woke up one morning, I realized I'd slept all night long, and I had actually put my feet on the floor and stood up, and I realized I didn't feel the need to try to stretch or readjust or anything like that before I got up out of bed.
Mhm.
And at that point in time, I knew something was changing.
That's pretty early on. So that's
It
impressive.
was
That
quick.
Yeah, so Eric again is a fast responder. So fast forward now, as Dr. Hiros mentioned, the literature and the outcomes and some of the graphs that you saw earlier were 3 years. Now, mind you, Eric is 6 years out now. So fast forward, and how many of these 3-mile, 6-mile, half marathon, 50-mile, 100-mile races have you done since you've been a Reactiv8 recipient?
I honestly couldn't tell you about the 5Ks, 10Ks, or the halves. I've done a
Too many.
slug of them, and I know I've done 250s, a 50K. I've got my 100, and we're actually going out to Utah to run an ultra marathon in April out in Zion National Park out there here shortly. So that's my next big
Wow.
one.
That's amazing. So as I mentioned earlier, I asked the question of Eric, if, were you a runner before? Did you ever think about running? And he said, no, that wasn't, I didn't even like doing it when I was when I had to. And so here Eric went from, struggling to get through everyday life to getting up at 2, 3 o'clock in the morning so he can get his 10, 13, 15-mile runs in before he goes to work, so that he can take care of his family and come home and do archery with them and hunt with them and all the other things that you wanted to do that you weren't able to do before.
Yep.
Pretty amazing. So I thank you, Eric, and I am just so honored that I have been able to be part of your story with this therapy and Reactiv8 and how it's changed your lives, and how we've been able to work together to share that with hundreds and hundreds of other patients around the world. So thank you. I appreciate it.
Forever grateful.
Awesome. Keep running.
I will.
All right. Thanks, Eric.
Thanks.
So next up, we have another veteran with us tonight, Damien. Kendra, can you? Yes. And so Damien, so this is interesting. So Damien's not my patient. It's still a story in our family of Reactiv8, also a veteran who I know shares a similar story to Eric in the sense of debilitating low back pain for over a decade, also seeking many treatment options without the answer of help or why or anything durable that was going to be able to make his life such that he could then also do the things that he wanted and needed to do moving forward. So Damien was just implanted recently with Reactiv8 or reactivated. Damien, it's such a pleasure to meet with you and chat with you this evening on our kickoff webinar for patients all around the country. And I would love to hear your story in more detail tonight as you share it with all of us. So thank you for being here.
Thanks for having me. Yeah, so my story goes back to I was in the Army as infantryman. I was deployed in Afghanistan. I was in an IED incident, blown back, and ultimately, at the time, I hadn't known it. I was kind of patched up, continued my deployment, and I seemed to be okay. It caught up with me later on in my military career. I would say I got home in 2011, June of 2011. And around 2012, I went into the Special Forces selection course, and I passed their selection, which is just a large attrition school. And then I went into their qualification course. And during one of those schools that they have in there, it was a long movement, and I was carrying a lot of weight, which I had done during deployment, which I had done up to that point, upwards of probably 100, 150 pounds, moving for probably 4 or 5 miles. But on this particular one, something new had happened to me I'd never experienced, and that was that my legs, back, everything just kind of stopped, like full paralyzed, just stopped. And then I fell flat to my face. And at the time, I asked the medics that were in the course there, what could we do? And they offered some things, but the course is 3 months. So I felt like this is something that's very painful and it feels wrong. Something feels off. And ultimately getting checked out by actual doctors and physicians, it came to the point of you're either trying to do something kind of desk job or much less extreme in the military, or you're getting medically chaptered out and removed. So I chose to get chaptered out, and after that, for me, it was pretty much a long downhill slope. The pain was constant. I was trying my hand, using my GI Bill, going to school, moving around, and the entire time it led me up to where I was living in Pennsylvania later on in my life, and then up until Reactiv8 itself, my implant. That whole time was me navigating the pain, whether that was me trying to avoid narcotics, because that was the initial thing, and I have too many bad stories of friends and other veterans on narcotics for ailments, and I didn't want to go down that route. That physical therapy, I don't know, 10 times, countless times. Injections, I think twice, maybe 3 times. And it was ultimately, I think it came, what was it? That was last year. I was implanted 21. So I think about late 2019 throughout 2020, I finally resorted to trying to utilize, I even tried medical marijuana to see where that would lead me. And it was fine. I mean, it did relieve some pain, but I didn't like how I was on it. It's kind of the same thing as a narcotic, put me in a state of mind and way that I didn't want to be in. And I couldn't afford to be that way. I'm a programmer now by trade, and which is a very sedentary job. I sit in a program probably 8-10 hours a day. And the mindset I have to be in to problem solve, I couldn't be in some kind of a stupor with any kind of narcotic or medical marijuana. So finally seeking out more treatments, I think we were approaching ablation as the next step. But before we got there, my doctor, Dr. Smith, pain management doctor, he's the one who recommended Reactiv8. And when I heard about it, I had no idea what it was. But I looked it up, and I tried to do my due diligence and read up on it. And I saw that they had some history on it already, very promising testimonials, and the data looked really, really positive. But the thing that hit me was the restorative stuff. That intrigued me. And kind of similar to what Eric stated, it was like, hey, I'm at the end of this now. I don't know what else to do. Something's got to give. And I was like, let's give this a shot.
That's fantastic. And so exactly just a year out, you had your implant on Veterans Day.
Yep. Yeah,
right?
I did. Yeah.
So what a nice gift back to you for
Yeah.
all the hard work that you put in for all of us. And so a year later, what's your pain? How's your function?
Almost gone, I would say, completely. And similar to things Eric said, he kind of hit home with, very relatable to a lot of things I had, and things involving just my children, picking my daughter up out of her crib, just going outside to run with them a little bit. Those things weren't, I mean, if I did attempt them, I knew I would pay for it later. it was, you know, and I do it for the sake of my kids and want to enjoy the time with my kids. But, you know, my wife and I knew it was like, well, you're gonna be in bed all day tomorrow, or you're gonna be trying to do something to mitigate it tomorrow. So now a year later, there's none of that. Nothing at all. I mean, I think last week or 2 weeks ago, I was just able to rake the leaves up and pull up on a tarp to the front of the house and things like those things wouldn't have happened, or they would have happened. And again, I would have paid for it. Now I did it, and there wasn't even a thought of there being a consequence to it. It was just the chore I'm gonna go do. And but probably the biggest one that affects me daily is being able to actually sit an entire day for my job. And I have a standing desk, so that's always that helps.
Mhm.
But just being able to stay in one position long enough where I'm not like, okay, where before it was, I don't know, every 10 minutes I was trying something, shifting my chair, moving, wiggling, standing up, doing whatever I had to do, where now I can be consistent in one position, probably for a whole shift and not think about it.
Well, thank you so much, Damien. I'm so happy to hear that your journey has been the one that it has, and very similar to Eric's. And based off of all the information we have there, you know, there's room for that to grow for you, right? You're gonna continue to see improvements over time and functional improvements. And I thank you. We all thank you for your service and for being part of the Reactiv8 family.
Thank you.
Nice. It was very nice to meet you tonight. Thank you.
You too.
Thanks. All right, Kendra, I'm gonna turn it back over to you for, I think we're gonna do, right, our patient ambassador discussion and then some questions and answers, right?
Yes. Thank you, Dr. Heroes, Dr. Langhorst,
Thank
Amy,
you.
and Eric. We really appreciate all of you jumping on and providing more information about Reactiv8 as a therapy and your experiences with it. We're very excited to launch our patient ambassador program here. We have partnered with a company called Patient Partner, where potential Reactiv8 patients like you guys on this call can sign up and reach out to already implanted Reactiv8 patients like Damien and Eric and ask them about the therapy, ask them about what the procedure is like, get advice for tips in recovery. And this is a really exciting initiative that we're able to offer to all of our patients. So you can sign up here using this QR code, and we can also send out the link after this call. It's a great resource for patients to be able to connect with other patients about the Reactiv8 therapy. And if you have any questions, feel free to type them into the chat box here, the Q&A. We will now move on to the Q&A portion of this. And thank you to those who have already submitted questions here. Dr. Langhorst and Dr. Heroes, would invite you to turn your videos back on. And I'd also like to invite Nicole to join with her video on. She is our reimbursement specialist here. So any questions you have on the reimbursement side of things or the RSVP program, we would be happy to answer. So with that, I will move on to the Q&A. And let's see, here's the first one. What are the most common etiologies leading to multifidus dysfunction? Is it prevalent in adolescent populations?
Meredith, you want
So
to? Go ahead.
Sure. So, you know, this can start with just even a lumbar strain or lumbar sprain, right? So an acute episode of back pain that happened, you know, years before the study starts. It doesn't have to be a major event. It can be a disc herniation, but it's really just any episode that leads to back pain. And you know, is it prevalent in adolescent populations? You know, I don't know that individuals or practitioners or providers are diagnosing in that population because they don't know necessarily to look for it. But we know adolescents, especially athletes that have back injuries all the time, that those, now that we know what we know, are the nidus or the start of this multifidus atrophy and dysfunction that occurs over time. You want to go to the next one, Kendra?
Yes. Is the intensity of the treatment adjustable or determined per patient?
Dr. Heroes?
Sure. So it is, the intensity itself is something that is kind of pre-programmed in. So when you meet with the representative, that first visit 2 weeks after it's put in, they will kind of work through that, and they will find a level of stimulation that gets a good contraction of the muscle, because that's basically what this thing is. It's going to contract the multifidus muscle slowly, and then it's going to let that muscle relax. And then 30 seconds or something later, it's going to do that again. So you don't want it so strong that it's uncomfortable, but it needs to be strong enough to contract the muscle. So that's what the rep is going to do. And then in terms of the scheduling and that stuff, that's pretty set, as I mentioned.
And do you have any experience implanting in patients with arachnoiditis?
So that's a great question. I actually have a patient with that now, unfortunately. And arachnoiditis is a nerve-based pain, right? So for those that don't know, arachnoiditis is basically where there's a clumping of the nerves in the spinal canal, and it's often due to maybe a prior surgery or sometimes even a certain type of injection. And there's some inflammatory response and the nerves get clumped. Traditionally, that's a nerve-based pain that would cause pain into the legs. So that would not be a patient that I would use Reactiv8 in, but more of maybe that traditional spinal cord stimulator. Would you agree, Rob?
Yeah, absolutely. The one allowance I would say is that there are patients who we see arachnoiditis in as an MRI finding who aren't symptomatic. So if a patient had axial mechanical lower back pain and no history of surgery and no leg pain, and they happened to have arachnoiditis as an incidental finding on MRI, I don't know that would 100% keep me from considering it. But as Meredith, Dr. Langhorst said, typically arachnoiditis is a nerve pain syndrome with burning nerve, numb, tingly pain going down the legs. So for the most part, no.
Is microdiscectomy a disqualifying back surgery?
So right now we would consider anybody who's had traditional spine surgery to be kind of disqualified. And again, could somebody with a microdiscectomy or a very minimally invasive type of surgery that didn't touch the multifidus, could that person potentially benefit from the therapy? Yeah, I don't think anybody's saying that that's not possible. We just don't have evidence for it right now. And the one thing that I really respect about Mainstay Medical is that they're being a very evidence-based, data-driven company. So until we have good evidence for something, we're not going to be pushing it out there. So unfortunately, right now, yeah, microdiscectomy, I would consider that disqualifying.
And this one is for Nicole. Are all insurances reimbursing, including work comp?
So we have seen reimbursement across several health plans. It's today a very case-by-case basis. The Reactiv8 Support and Verification Program is a patient access program supported by Mainstay Medical, where we have a team of prior authorization specialists. We support the patient throughout the authorization and the appeals process for commercial health plans, Medicare Advantage, workers' compensation, accident claims. And we help to support the patient throughout the process to gain access to Reactiv8. It's still a very case-by-case process. We've seen some reimbursement. We've seen one or two positive coverage policies come out there, but Reactiv8 is technically considered a novel technology. But our patient access program works very closely with our patients and our physicians and the insurance companies to help to gain access towards it. So with that said, it's very encouraged that every patient becomes very involved within the process. Having you guys be very incorporated into the process, providing impact statements, helping along the fight really does make a difference for approvals at the end of the day.
Thank you, Nicole. Back to Dr. Langhorst and Dr. Shiros. Where is the battery implanted and how long does it last? Does it need an occasional replacement?
So, okay. So typically the battery is placed either in the buttock or the flank area, and that will be determined between the patient and the physician prior to implantation. People wear their pants or garments in different areas, so we'll find an area that's most comfortable for you. And that, again, that'll be predetermined. This is what we call a primary cell battery, so it's not something that you have to recharge on a regular basis. These batteries are actually vetted for 5 years of continuous 24-hour-a-day use. But as Dr. Hiros mentioned in the beginning, during the program, you use it for 30 minutes twice a day. So we're not even near using it, anywhere close to its maximum amount of time within 5 years. I do know that we have a battery out 8 years that still has not been replaced. So I don't even know that we have an exact time frame of how long one of these will last due to, the inconsistent nature of how they're being used.
And for thin patients, is the implanted device bothersome at all?
So I can take that one. I mean, nobody likes having a battery in their back. So that, it's kind of unavoidable that it's not the most pleasant thing. But like with other types of spinal stimulation, with spinal cord stimulation, for example, for the most part, these things are very well tolerated. In rare instances, the battery becomes an issue, but that's pretty uncommon. And I'd say there's a kind of a bell-shaped curve. There's a few people who it's a horrible thing, but then there's a bunch, at the other end, there's some people who don't love how it feels, but the benefit from the therapy just so far outweighs anything else that it's just not really a real issue on a day-to-day basis.
And is physical therapy recommended in addition to this procedure to further promote healing and strengthening?
So I can take that one. The interesting thing was when we did our clinical trial that started back in 2016 with some of the outcomes discussed tonight and the graphs that you've seen, that was purely using Reactiv8. So that's right, your own internal physical therapy for the multifidus muscle. And that was basically so we didn't have confounding factors of if the patients were getting better, how could we say if it was Reactiv8 alone or Reactiv8 or physical therapy alone? So the therapy, all of the patients that are implanted with Reactiv8 are required to have physical therapy and good, robust physical therapy, and sometimes multiple sessions and rounds of physical therapy before implantation. And so right after implantation, we really want the Reactiv8 device to do the rehabilitation that it was designed to do on the multifidus. Now, once you're outside of the, again, kind of post-operative period where there's some activity restrictions for maybe 6 weeks, and you're getting back to normal activity, oftentimes we'll have our patients go to get physical therapy to get functional fitness and regain general strength and more of a health and wellness program, but not necessarily to help with reactivation of the multifidus muscle, as that's the nature of the Reactiv8.
And we have a fellow veteran on the call who wants to thank Eric and Damien for their stories. The question is there an option for the VA to help with the cost? Nicole, can you provide an answer?
Yeah, sorry, I had trouble with the mute button there. Absolutely. So again, this would definitely come through the Reactiv8 support and verification program. So all you would do is just work with your doctor's office to collect the relevant information, such as your VA referral. We would go ahead and work with your referral and the organization to help get the authorization to get that approved for the therapy and the procedure.
Thank you, Nicole. And I know that we're at time here at 6:02, and we've received a lot of questions in the Q&A. So any that were not answered on the call, we will follow up with you with an answer. I want to thank Dr. Hiros and Dr. Langhorst again, as well as Damian and Eric for sharing their stories tonight, and Nicole for answering some questions on the reimbursement side of things. Thank you all for joining, and we appreciate your time tonight.
Thank
Thanks,
you.
everyone.
Thank you.
Thank you.
Thanks.
Bye.